Doctor, what are the complications of IVF? What are the risks associated with IVF? IVF is generally considered as safe procedure, but like any other medical procedure, it has some risks associated with it. Let's take an overview of all these risks associated with IVF and potential benefits of IVF. I'm Dr. Yugali. I'm fertility and IVF specialist. Key risks associated with IVF. Risk associated with ovarian stimulation. It is OHSS or ovarian hyperstimulation syndrome. Then second one is risk associated with pregnancy, like multiple pregnancies, higher chances of abortions, ectopic pregnancy and birth defects. And third one is risk associated with the procedure itself, that is egg retrieval procedure. Ovarian hyperstimulation syndrome can occur when response of the ovaries to standard dose of injection is higher than expected. There are more number of follicles which are being formed in the ovaries, because of which ovaries are swollen and sometimes they are painful too. It is less common these days because of change in modality. It is seen more in patients of polycystic ovaries. But this can occur when response of ovaries is higher to the standard dose of IVF. There are multiple follicles which are being formed, and because of this ovaries are swollen, sometimes they are painful too. It commonly happens in patients of polycystic ovarian syndrome. Expert can identify, predict and prevent it effectively. Risk associated with pregnancy, like multiple pregnancy. When more than one embryo is transferred in the uterus, 20% chances of multiple pregnancy is there. Triplet pregnancy is very rare these days because hardly more than 2 number of embryos are transferred in the uterus. Although twin pregnancy is medically high risk as compared to singleton pregnancy because of the complications related with the pregnancy. Medical disorders like high chances of high blood pressure, high blood sugar like diabetes and anemia during pregnancy. Complications related to pregnancy are high chances of abortion and premature birth, because of which babies need to be transferred to the NICU units. IVF pregnancy has higher chances of abortion as compared to natural pregnancy, and it is more so because of advanced age at the time of IVF. Ectopic pregnancy, although very rare with IVF, but possibilities cannot be ruled out. Best is, because women are under constant supervision by the experts, early identification treatment can prevent further emergency interventions due to ectopic pregnancy. Overall risk of birth defects is not significantly higher with IVF pregnancy as compared to natural pregnancy. Risk associated with egg retrieval procedure. Egg collection procedure is although a minor surgical procedure, but there can be risk associated with it like bleeding, infection or damage to surrounding organs. Anesthesia related risk can also arise. Physical fitness before planning IVF is very important. Every patient should be physically fit for anesthesia and pregnancy. Despite risk associated with IVF, IVF is well-established procedure with good safety records. It has improved outcomes and reduced risks with newer modalities. Overall, for most people, the benefits of IVF outweigh the risks associated with IVF, particularly for those who are not able to conceive naturally. It is essential to discuss all IVF related risks with your treating specialist before making informed decision. Thank you so much.